while you are having a constant headache. Okay? So this is a painless procedure. It's not painful. So but when you get inside, you will just be hearing sound of the machine. Don't be scared, okay? Morning, once again. I'm Chukwu, Senior Radiographer in Foot. You're welcome to the Radiology Department. This is the MRI suite where we carry out various MRI investigations. And what is MRI? Sometimes we may just be hearing MRI. What does it stand for? MRI stands for Magnetic Resonance Imaging. Magnetic from the resonance imaging. And what does it do? Sometimes in radiology we hear they deal with radiation. This one makes use of what we call non-ionizing radiation. It doesn't make use of ionizing radiation like X-ray, CT scan and mammography. This one makes use of magnetic field and radio wave. This is the buzzer. In case you need my attention, if you are feeling uncomfortable or anything, just press this buzzer. I'll speak with you inside there. Okay. The hydrogen protons, and it utilizes that because the human body is made of mainly water, and water has most hydrogen. And hydrogen proton is what this machine detects the signal from that hydrogen proton. That's what it detects and reconstructs it into images to get the anatomy and pathologies of various parts of the body. Here we do MRI of almost every part of the body, like the brain. As you can see, these are the protocols that we do here. So these are all the investigations we do here. We do the head, the neck, extremities, your hands and feet, and the upper and lower extremities. Do the spine, the abdomen, everything. In fact, we do everything. So what this MRI, the advantage of this MRI over others is that it has a very good soft tissue differentiation. Any pathology that is related to soft tissue that is not bony, this MRI is the gold standard for it. So for the brain scan, some of the indications for brain scan here, you have brain tumor and have like hydrocephalus. So with this MRI now, we have seen what is going on here. We can know if there's any damage to any other parts of the brain as a result of this hydrocephalus. So that's one of the things those. Then if there's someone has an accident and there's internal bleeding, what we call hematoma, maybe there's blood somewhere that may disturb the functioning of the brain, this MRI can pick it. So there are many others. Maybe there's tumor in the brain, there's a growth somewhere in the brain. This MRI can pick it. Remember I said it's very good for soft tissue differentiation. So other studies, we have the spine, degenerative changes of the spine, and like for the lumbar spine for little children, we can use it to diagnose caudal equina syndrome also. And maybe sometimes some persons may be having lower back pain. You'll be complaining of pain. You don't know what is wrong with you. With this MRI done on your spine, whether the cervical spine, maybe the cervical spine, your neck region, the thoracic spine, the lumbar spine, and so on. Most people in this part of the world most times complain of lower back pain. I don't know what is the cause. When you do this MRI now for your lumbosacral region, you see what is wrong with you. So those are some of the things. Even this machine now is 1.5 Tesla. You know, MRI, they are graded in Teslas. We have 0.3, 0.36, 0.33, 0.5, 1 Tesla, 1.5, 3 Teslas, 7 Teslas. But those ones you can't, those 7 Teslas, I don't think you can get it around here. But within this our region, I think this is one of the highest from the GE company. So we are saying to the public, wherever you are around the southeast, south geopolitical zone, or anywhere in Nigeria, you can send your patients down here for your MRI scan. We have our well-trained professionals here who can handle your patient very well. Sometimes some persons are scared about seeing a machine like this. Sometimes they've heard of X-ray and they are very scared. If X-ray that is like that and is very dangerous, what about this one? Is there any contraindication? Is there any side effects? Actually, for MRI, there's no proven side effects at all, because it's not making use of ionizing radiation. It only makes use of the magnetic field there and interacting with the hydrogen atom, the protons, which it picks signal from and reconstructs it into the images we see. So it doesn't have any side effects. The only contraindication or the hazard you can face here is that related to metal. As you know that this is magnet and it's a very high magnetic power. It's a very high magnetic field, 1.5 Tesla. So anything metal, ferromagnetic substances shouldn't come close to this environment. So for some patients that may have some metallic implants in them, like cochlear implants also, cardiac pacemakers and the rest of them, they don't have to do this investigation. They have to be screened. If it's an implant that is MRI compatible, the doctor has to indicate, and there must be something, there must be a consent, there must be something to certify that this is MRI compatible or compatible, yes, before the patient can go into this. Apart from that, there's no other hazard, there's no other side effects for this. Also, for some patients, some persons that have tattoo on them, you know, some tattoo, there are some magnetic particles, there are some metallic particles that is used in doing tattoo. So if a patient has tattoo on him or her and goes into that MRI, after the scan or during the scan, you can feel some heating effects on that tattoo area. That's why it is advisable that if you have tattoo, please inform your doctor or the MRI specialist before going in there, because you may have some burning on you. Those are just some of the contraindications you may have in MRI. So apart from that, there's no, and before the patient can come here or patient relative, he or she must be screened to ensure that he doesn't have anything that may interfere with the magnet, because apart from those hazards you may face, like pulling metal objects to itself, your ATM, your wristwatch, once you enter there with your wristwatch or your ATM card or your phone, automatically that machine will format it. It can damage your ATM card, it can damage your wristwatch, it can damage your phone, because it has very high magnetic power which interferes with some of these gadgets. That's why you don't enter there with any electronic or whatever.